Welcome to another edition of On the Move with Dr. Beth. Today, talking about the estrobolome, so estrogen and your microbiome. So, your gut bacteria impact your hormones in a big way. The estrobolome is a specialized category or community of bacteria, and these bacteria produce an enzyme called beta-glucuronidase. And what beta-glucuronidase does is it kind of regulates the amount of estrogen that gets reabsorbed back into the system versus being excreted. So when this system works well, things are great. When this system does not work well, things are not so great. So you can start to develop, if the estrogen keeps getting recycled in the body, you can start to develop symptoms of estrogen dominance. So things like extra abdominal tissue, extra tissue in the triceps, mood swings, brain fog, fibrocystic breasts, heavy menstrual cycles, that wired but tired kind of feeling. Some of the things you can do is really focus on fiber intake. I know I personally don't get enough fiber in my daily repertoire, but you want to focus on about 30 to 50 grams of fiber daily. And what that fiber is going to do is bind to the estrogen and take it out of the body, right? Or help take it out of the body. Obviously, regular bowel movements are a must, because again, that the bowel is going to help excrete these hormones, and they're not going to be recycled back into the body. So without enough fiber, it's kind of like trying to empty your bathtub with a half, your drain is half open, right? So, or your drain is half closed. So it's not going to do that very efficiently. So some examples of higher fiber foods: sweet potatoes, winter squash, raw unsalted pecans or walnuts, dried organic prunes, figs, apricots, chia, and flaxseed. I love to sprinkle, we make those fat bombs. I love to sprinkle chia seeds on there. It kind of helps thicken things. Those are some good examples. If you're looking for some microbiome support in terms of probiotics or prebiotics, some good food sources of that are sauerkraut, kimchi, also onions, asparagus, garlic. And in terms of probiotics, if you're taking a probiotic, you want to look at a multitude of different strands, not just the amount of colony forming units. So digestive habits, bowel function is another big thing to pay attention to. I know I focus on that a lot, but making sure you're going to the bathroom every day. Ideally, the amount of your stool, you want to have the amount of food that you ate the day before. So castor oil is effective if you're having a really hard time, going to the bathroom. I like the Queen of Thrones brand. It's organic, hexane free. So doing castor oil pack on your abdomen. High dose vitamin C. You've heard me talk about magnesium before. So aloe vera. So just some of the things that you can help support bowel function and really make sure you're excreting those excess hormones.